All right, so today, first we're going to talk about the bony landmarks for the hips and thigh. So we're going to start on the anterior side. So we did talk about some of this in the previous chapter, but just to review. So the first thing is, remember, there's three big bones in the hip or the pelvis for the hip girdle. So the first is going to be the iliac, or the ilium, sorry. So it's going to be right here. So if you go to that soft space there at the side and you work your way down, then you're going to feel kind of that hard, kind of round area. So that's the ilium. And an important spot on that is going to be that ASIS, or the anterior superior iliac spine, because you have an anterior inferior iliac spine right below it. We'll talk about that one here in just a minute, a little bit more, but it's just below it. And then, of course, like I said, you have the crest, and then just underneath the crest, you have the gluteal surface of the ilium. So that's all part of that ilium. Now, the next one that you have is the pubic bone. So it's going to come across this way. We're not going to palpate in that one really close, but you know where it is, right? It kind of makes that circle at the front. Remember, that was the origin for the rectus abdominis, right? So that comes all the way down to the pelvic area. The next one is the ischium, and that's going to be on the back side. We're going to get to that one here in just a second. Before we do that, though, we're going to talk a little bit about the femur, right? Because we have the big femur that's here on the upper leg. So the big spot that we talk about on that one is pretty simple, is the greater trochanter. Now it's going to sit down a little bit lower than you would expect, right? Because we want our hips to be up here, but it's really going to be right about here. And if I want to make sure that I'm on it, what I do is I internally and externally rotate the leg, right? And I'll feel that greater trochanter just roll right underneath my finger, so I can find it really easy. Now, there's also a lesser trochanter, but that one's going to be way up in the groin. So we're not gonna find that one right now on him, but it's way up in there. If you really want to get in there, you can find it, but it's uncomfortable for a lot of patients, right? At least for palpation for us. So yeah, that, and we're not going to talk a lot about the lower part right now, because we're going to cover that when we talk about the knee here in the next, probably in one of the next videos. So next thing I'm going to have him do is I'm going to have him flip over onto his stomach. All right, so now we still have that iliac crest, right? If we work our way around, this was another one that's from that last chapter. So if we were to expose just a little bit, you can see those back dimples. So that's going to be the PSIS, or the posterior superior iliac spine. So it's going to be right there, those back dimples. Now you also have your sacroiliac joint right here, right? So that's going to be where the ilium and the sacrum come together. So you can feel the edge of that. As you kind of poke around in there a little bit, you can kind of feel where one starts and the other one stops right there. And then the big pelvic bone that we have here, right? Because remember, so far we've had the ilium and the pubic bone. The last one's the ischium. So the ischium is going to be that bone that's right up in here. So if you've ever sat on bleachers for a long time, your butt starts to hurt, you're pressing on your ilium probably. So it's right, you got this, the gluteal fold here at the bottom of the butt cheek, basically, and you push up in there, and that's where that ischial tuberosity is, and that's where the ischium is. So it's kind of there on the back side. A couple other landmarks back here. Already mentioned the gluteal fold. The gluteal cleft is just your butt crack, right? That's just the crack down the spot down the middle there, and that's pretty much it as far as on this side. So that's all of the bones for the hips.